Well, good morning, all. I am excited to be back. Thank you, Kristen, for leading a great meeting last month. I am going to officially call this meeting to order. And I will just briefly go over the highlights that we're going to cover today. Today's agenda, we're going to be covering committee updates. We're going to approve our prior minutes. We'll hear some departmental updates from Dr. Mati, and we'll have announcements. So I will go ahead and move us along. And at this time, I will entertain a motion to approve our Zoom video from July 18th as the minutes. Is there a motion?
So moved.
Colleen, thank you. Is there a second?
A second.
Kristen, thank you. All in favor, say aye.
Aye.
Thank you. Are there anyone opposed? No. Okay. That was unanimous. So we're going to go ahead and move our meeting to our next item, which is committee updates. So our Vice Chair, Kristen, I'll let you lead on this item.
Good morning, everyone. Happy to see you all. I believe some of the committees were able to meet between the time of last meeting and today's meeting. And so we'll just kind of go down the list to see, at least from the chairs of the committees, if there's a future scheduled meeting and they'll have updates in the future, or if they were able to meet prior to now. So Dr. Shatcham, I would start with you with the academic committee.
We did meet this month, or this last month, thanks to Craig and organizing that. I was pulling up my notes I was like, please, Kristen, don't call on me first.
Oh,
But
I'm
you did.
sorry.
Totally fine. These are fine. I played it in my mind earlier. Okay, so what I think our biggest goal for the academic health partnerships is to figure out what does successful partnership look like and how do we measure that. So we have several different structures of how and who is working with the health department, and kind of need to do a more deeper dive on what is it exactly that we want to, how can we support, what can we do, and what do we want to do as next steps. One of the things that came out as an important opportunity, I think, was to help figure out how do we recruit participants or support participants from that were requested last month during our board meeting for like CHIP and that sort of what is the word I'm looking for, committees.
Thank you. The action teams, you're absolutely right, Doctor.
Thank you. Thanks, Greg. So the action teams, we want to support that. So if we could tell us how to do that, that would be super, and we would be more than happy to do that. Those are the big action items. Craig, did I miss anything? That was the big one.
You didn't. I would kind of add sort of tangentially to that, sort of the lay of the land, what currently exists with some of those agreements that we have. I was not familiar with the UMSL agreement that Dr. Grigsby brought to our attention. We talked about the SLU law one that Dr. Gatter indicated how we might try to pursue that. And there's a lot of changes, but obviously we also want to be supportive of the longer term student intern fellowship type of participation with the local Department of Health.
Oh, and Morgan came up with a really excellent.
Yes.
And we have to figure out how to fundraise for it, but it's just figuring out scholarship programs for students that go to get their MPH in our region and then work at the health department, finding scholarships to support them to, as long as they guarantee to do the public health work after. So I think we probably have to do a flip version of that, but that's neither here nor there. That's future plans.
Whoop, whoop. Well, congratulations
you.
to the team. It's an excellent meeting.
Thank you.
You're welcome. April, do you have any updates?
Yes, I do. Governance and nominating recently met, and I was taking notes, so I'm actually going to read off of my notes. But um, for those who have not closely read what's in the bylaws, governance and nominating is responsible for two main functions, which is to open a 60-day nominations process, by which folks who have interest in joining the board can formally apply. And then, of course, we would present a slate to the rest of the board for a vote. And then the other function is an annual bylaws overview. So I don't believe, I have not found evidence that there has been an annual look at the bylaws in recent years. But we have spoken in the past, right, about the need to kind of modernize the language that is there. So Colleen and Liz and I are going to be working on those two main goals over the next several months. And we've developed a work plan that will kind of help us with scheduling our meetings and making sure that we are focused on those main goals. If there are other folks who feel strongly that although they're on a committee, but would also like to help with any aspect of governance and nominating, I would welcome folks who want to join two different teams. But we are going to be focusing on nominations first, and then we'll be looking at the bylaws later next spring. So that is an update for now, but of course, anything that needs to come to the board for your vote, we will be bringing you updates as that work happens over these next several months.
Awesome. Thank you so much, April. And last but not least, the Community Engagement Committee. We did meet. I'm also pulling up my notes. We just did a brief introduction of each of us, because some of us are new to the board, and so just wanting to learn their skill and scope in the region and the work that they do. We talked about not sure quite what to call it. I don't know if it's a sector or department, but the new community engagement and public health that Shantae will be leading. We discussed that because it seems very fitting for us to really work collaboratively to support your efforts in launching that. So we kind of just went through one of the prior slide decks that you've shared at a previous board meeting to kind of go over your initial thoughts for your initiatives. And we also talked about coordinating a meeting with Shantae to get more clear scope from her. So we already have one scheduled in a couple of weeks to hear from her and see how we can best support the department in those efforts. We also talked about the pro bono clinic that Dr. Ludi and Brittany work very closely with, seeing as though the city DOH doesn't have a clinic in the same way that the county does. What are opportunities where we can partner with some free clinics in the city that could provide services, particularly thinking about when you're launching the community engagement program, like where can we refer people to that's cost effective or no cost? So that was an idea that came up. We discussed some resources, and of course, Shantae will follow your lead and think of all the resources that make sense. But ultimately, that was our big highlights of really just figuring out how we can support these efforts. Did I miss anything, friends? No. Okay. So April, I didn't know if you wanted to offer up your template that you were creating to support committees in their planning.
I certainly can. Do I have the ability to share?
Yes.
Sure. Okay. One moment.
While she's pulling it up, I just want to say, I mean, the bar needs to be higher, but the fact that y'all met, all three of you have updates. There were notes. People could talk. Woo! We're doing great, folks. So I just wanted to start there. This board has been wonderful to me, but I feel like active, consistent committees has not always been a thing. And grace through COVID, grace. So it doesn't take away from the strength of the board. But if I were to ask for one thing, it would be for active, clear outputs, even if there's like one clear output a year. And just trying to think about that. So I'm just really excited. I wanted to make a note to Shantae. Dr. Ludi, I'd love to take a side meeting about the free clinic and talk a little bit more about that on the clinical side, even as it progresses through the outreach. So I'll have my executive assistant reach out, but really excited about that. So just wanted to say thanks, everyone. You're nailing it.
Well, thank you. You know, I think maybe the first meeting that I attended this past spring, we talked about kind of what folks wanted to get out of serving on the board. And I certainly want folks to be serving who feel like this is meaningful work. So I personally feel very strongly about committee work being meaningful. And so definitely thank you to our chairs and our members for being active, so we can really show the value of service and make sure that we are aligned in the work that we're doing to support our public health colleagues. So I have shown my screen here. Hopefully everyone can see it. But this is a template work plan. It's fairly simple, but it really highlights what work is kind of to be done over this next year. As you can see, kind of separated into different columns with the issue or the topic that's going to be covered, the date of the meetings, what kind of outcome do we expect to have from those meetings, what's the role that we're going to play during this committee meeting, and what might we need from our colleagues on the staff. And if there's something that needs to come to the board, when would that likely be? And so very happy to think about how we put this in a place where folks can see it, so that you're not just kind of waiting maybe for me to share it once a month. But if this is something that folks find helpful, I certainly think this is, a helpful tool. But we plan to use it to order our steps as we go through this next year. And you see there's, TBDs here because we don't exactly know how this timeline is going to work. This was something that really is in draft mode. And actually Liz is stepping up to take a deeper dive into this for our work, to maybe create some additional tasks and some action steps to make sure that we know exactly what needs to happen to accomplish the goals that the governance committee has set. So I think I have this going through the end of springtime, and we'll kind of have to figure out what needs to shift or change. But we're also hoping that as we have new committee members or new members on the board, that we'll also be able to add to everyone's committee rosters. So you'll be able to get work done that feels like not as heavy of a lift for maybe the few people that are on each committee now. But we have, hopefully we will bring you 3 folks for the board to vote on later this fall. So I'm going to stop sharing. Kristen, are you planning on working on or having a template that is similar?
I did like the template that you used. This meeting, I just did a basic points. But I think as we figure out the structure and definitely meeting with Shantae and seeing what supports that she needs, will help us kind of guide our efforts in supporting the DOH. But I do like your template. I think it's an organized way to not just maintain record of our efforts, but also our accountability as board members. So I really like that piece of making sure that we're doing meaningful things while during our time here.
Definitely. I can send this out to members of our board after this meeting too.
I
May
think
I
that's enough.
suggest that either at this meeting or a future board meeting after people have looked at it, I would love to have a formal agreement about its standardization across committees, because I think it's fantastic. But I don't want it to be sort of, if everybody likes it, it would be great if it was standardized and even shareable, like somewhere where everybody can log in and see what other people are doing. Or even just the committee chairs have it shared, if that causes too much chaos. But maybe something to suggest if there's like a formal adoption of it versus if you think as board chair, you just want to make it optional. But if it were standardized, April, I just thought it provided a lot of great insight. It would really help some of our FAB efforts to be able to show, because that's a big part of the FAB criteria, is seeing that the board is active and participating and that there's documentation of it. So just something to consider.
Yeah. Do you currently have a portal where folks who are external can log in and see
The city has
documents?
really strict rules around if you're not civil service having access to our documents and things, so I can ask. And if it's something we can set up, I'm happy to do it. But if not, I think even our IT can help people just help with like just a shared document space, or we can start one for the board. But I do think there's some like strict rules about integrating people who work with the city and not work with the city on our official platforms. I'll follow up with you about that, April.
Great, thanks. I'm happy to kind of look at whatever options we have. I use Google Drive a lot, but I know many folks find it difficult to access Google Drive. I also have a Dropbox that I can use, but yeah, let's think about that and maybe put that on the parking lot, and we can talk about standardizing a template. And also I'm looking at the chat, and Liz, did you want to chime in about your thoughts on kind of updating monthly with the status update?
Yes, I just had this, I'm laughing because I just had this conversation with the team at my day job yesterday, but not sure folks' thoughts on maybe a standard status report too could be really helpful in this space as we're reporting out on progress in terms of looking back on what have we accomplished this last month, what are our goals for the next month, what are some wins, and how are we tracking towards things, right? Are we running into any barriers that we maybe need help from, I don't even know who, but I find it can be kind of helpful. I also understand it is an added administrative task. So if folks are not feeling it, I am also not offended.
I'm a fan, but I love any kind of report because I'm
I do
weird and
too.
extra. So not that I want to add more work.
Documentation, I don't know.
I think the more that we can express and show like the ways that we're thoughtful about our engagement, how it's intentional, I think is always a win, particularly, I guess, just hearing as Dr. Mahdi was mentioning, if there's other parts of their responsibilities to be able to prove our effectiveness. I think any ways we can contribute to that is helpful.
Do you have an example of something that is working well, Liz, or something that you've maybe used for your team that you think we should think about?
None that I could readily share just because they do have some proprietary information on them, but I can definitely just template some out really quick, just clear out some info. And I can send them back your way, April. And then maybe in our next meeting, we can review them or people can pre-read and we can kind of figure out like what works best for us. My experience, it's best to kind of tweak them to what you're actually needing. So if there's a section that doesn't make sense, like let's get rid of it, right? And if there's something else we think would be valuable, we can add it in there. But yeah, I can send some your way.
Thank you. Maybe this is something we can add to the governance committee work list. It seems like a governance
I think
task.
that would make sense.
Yeah. Awesome. Well, thank you. We'll come back next month with maybe some options for what that kind of status update can look like. And we will also maybe talk about the standardized template for the committee work plans. So I'll reach out to our committee chairs so we can talk maybe a little bit about what that looks like. I do know, I believe, Dr. Shockham and Craig will have to tell me if I'm wrong, but the Academic Partnerships Committee also has non-board members, non-Board of Health board members on it. So if there's already some kind of work plan that Academic Partnerships has, then that would be also nice to see or just know.
That's good.
Okay. Any other feedback or comments about committees or committee work? No? Kristen, thank you so much for getting us in order and making sure that everyone knows what they're doing and kind of where they're serving. Okay, well, I'm going to go ahead and let's move on to department updates, and I'm going to turn it over to Dr. Mati.
Well, hello, everyone. It's our favorite time, department updates. We will now refresh, stop checking emails, and see. I would like to say, while I'm not allowed to have favorites, this may be my favorite cover. How cute is that? Honestly, my team are so creative. I'm a little obsessed. I just thought this was really cute and Olympic power. I was split during the Olympics. Zimbabwe had 2 finalists for the track and meet who lost, but we were very excited that they made it to the finals of the 100-meter track. And I was so proud. My girls were in Olympic bliss. So I just thought this was super joyful to see young children this excited about the Olympics too. And if you are still looking for some Olympic fever, please log into the Paralympics. But let us get started on the departmental updates. So as always, I have a love note from you, read it. But really you don't have to, because the high impact, I think, is where it's at. Just want to shout out our commissioner who's on the call, who does not love the spotlight, but who is fantastic, amazing, and does so many things that have bettered the department. She she's really big on sponsoring folks and is going to be, I'll have her come back if she's willing to talk about this really amazing tuition reimbursement program that she has championed and that is at the final stages, hopefully, of approval at the city. That will just be another way to really show value for our staff and increased retention efforts. But she recently and a group of our communicable disease folks went to the annual NACCHO conference in Detroit, Michigan. They had a poster that they were presenting, and you can see them cheesing. Later on in the report, you will see a gorgeous selfie with the commissioner and them in it as well. But just love to highlight that we're not just doing work in the community, but we're also continuing to develop the next generation of public health workers, which is why you see a lot of advancement and promotion within the division. It was National don't want to say what it was national because I've forgotten the name, but it was like National Community Health Center Week. And we made a visit to the Family Care Health Center, who is one of our 4 FQHCs in the city. I was really proud with my twin in the county, Dr. Kanika Cunningham, to sit on a panel where we got to engage directly with parents and children and talk about back to school and answer their questions. They have an incredible team of pediatricians and behavioral health experts. And I learned that day, and I would love people to amplify this, that Family Care Health Center currently probably has the fastest time to get folks in for autism screening and behavioral health follow-up. That's typically close to 6 months to a year. They can get people in weeks, and they have a very experienced team. So again, I think people really underestimate the expertise in our FQHCs. Unfortunately, we are in a COVID surge, and from a health perspective, I need people to be aware, even though the press has given up and the CDC is COVID light these days. This is akin to the Delta surge. So Delta was serious during the pandemic, the second largest surge. We think that this is close or rivals that with the new variants. Thankfully, we're not seeing an uptick in hospital numbers, but we have been sending out a lot of preventative measures. And as Board of Health members, you should be champions for COVID. Please be encouraging, especially people who are high risk above the age of 65 or who are immunocompromised, to consider wearing masks indoors, to hand washing, social distancing, all the same things apply. I want to shout out Shantae and her team who have been, Shantae Craig, actually, who started this initiative. Shantae, who's helping him amplify it currently. With every community outreach event, we are giving away free tests, and we will be rolling out triple tests that can test for RSV and influenza ahead of respiratory virus season. So we're being very proactive. We have N95 masks. Shantae can send you a link to, or email you a link to the form if you'd like to order some for your jurisdictions, especially for the free clinics that were mentioned earlier. We give those free of charge. Shantae and Craig are going to be targeting the schools to support teachers and children ahead of school starting this week and next week. And so we're being very proactive about supporting folks. We want kids to stay in school. Last thing is the CDC will be rolling out a new vaccine that addresses these variants in September. So we'll be doing a big educational push. So please send us a selfie when you get your vaccine and point at the Band-Aid like a corny public health champion. Maybe we can do a campaign where the Board of Health is spearheading that. So would love to see that. Colleen, your hand is up, so I'm going to come to you right away before I keep talking because I love an interactive Department of Health update. What's up, Colleen?
Many of you probably heard this morning on NPR, they had the former chair of the White House COVID, whatever, task force. And the recommendation they provided was that for most folks, they should wait till the fall vaccine comes out. Is that, you might have said that.
That's exactly the recommendation. And it was hard because the Urban League does a beautiful job and does this like at the Dome, like back to school event. And they were like 20,000 people. So they came to meet with me and they were like, let's just do the vaccine we have now. And I was like, no, actually, from an ID perspective and what the CDC is recommending, we should wait for that. And I wish they had gotten it in time so that parents could get kids vaccinated before. It's going to be really hard for parents to get kids back and then figure out vaccination, but it is what it is. Because of how high this surge is, Colleen, we genuinely don't think the current vaccines have as good coverage. So in good conscience, I would hate for people to do this like this week and then a much better vaccine come out next week. So that's a great question. Shantae, if you can make note of that, because I'm getting that question a lot, let's make sure our education campaign on socials and our big push really highlights the fact that maybe even this week, she should do the kind of, we recommend waiting for that vaccine, because I'm getting that question a lot. So that's a great question. Are there questions?
One more related question. I'm sorry. For those of us who pretend like we are epidemiologists in the workforce that we're in,
yes.
For our organization, for example, has compulsory flu vaccine. Do you think that, are you sort of reading tea leaves that COVID will sort of move in terms of workforce recommendations to be like flu, where, for example, healthcare organizations require both an annual flu and an annual COVID vaccine?
As an ID doc, I think that's the natural place we're going, but the CDC has not been really forthcoming. And honestly, I think they got burned so much that anytime they say what they think they will do and they have to shift, it's like, you lied, you liars. Don't lie to the people. So I actually support them and just chilling until they have something definitive to say, because we're all still healing from the craziness of that. But honestly, Colleen, from an infectious diseases and infection prevention perspective, I think that's where we need to go, with a caveat. I do think that until we get there, it's not like a switch button where you suddenly have an influenza-like state, that there will be maybe a tiered approach where hospitals may have to be a little bit more, or people who take care of, healthcare providers, people who take care of immunocompromised people, have maybe a little bit more strict of an update if they can get away with it. I support that measure, but I think the implementation of it is a nightmare. So I do think what you're proposing is likely where we're going. Great questions. The next page is one I want you to pay attention to, because this is one of those categories where we're not in a bad situation yet, but we're seeing a lot of activities around mosquitoes, ticks, and other animals. And so West Nile, if you missed it in the news, the county reported the first case of West Nile virus, typically a very benign virus that has influenza-like symptoms, but can make especially immunocompromised and older people very sick. And so the mosquitoes are testing with high burden of West Nile virus in the region. So while we haven't seen as many numbers, and these are mostly mosquitoes in the county, we know that mosquitoes and diseases don't stop at borders of counties and cities. So we wanted to make you aware that we have had a case in the county. It has most bites will not lead to infection, and 80% of those who contract the virus will be asymptomatic or have those mild flu symptoms. But severe infections, even though rare, can be very debilitating. So we just want you to be aware that mosquito prevention is something that we are pushing heavily. You will have seen it on our socials, and you need to be using preventative methods that have DEET, because mosquitoes are also transmitters of other things like dengue, which is endemic to the region, Zika. And even though they're not high practice, especially for those of you who are traveling as well, I just want you to be aware. And this is just a good time to teach you about other vector-borne diseases like ticks and mammals. So this is a nice page to just copy and paste and learn a little bit, but we do have West Nile in the county. I want people to be aware and prepared. And again, adults can do whatever you want, but I just am very intolerant of children not being protected. So for your kiddos, it's sunscreen and a preventative method for mosquitoes that includes DEET. It's looking for the DEET that is really important. So please be looking out for that. We also talk a little bit about Lyme. That has been a long going thing. And just want to shout out our Environmental Health Bureau and Pest Control, Vector Control, and Communicable Disease, who've been working together tirelessly being preventative. For the rest of the report, I want you guys to do your own reading. But the Behavioral Health Bureau just crushes us. Look at us. We're in libraries. Narcan boxes continue to spread across the city. Our numbers are up. We're getting people tag us to post about how proud they are that their city health department has Narcan. It's like my favorite thing when someone tags me or sends me a picture when they're out about in town. We had a few naysayers, but I'm intolerant of that. We march on because we know this is a data-driven approach. I'm like, come on, man, find some. Miss me with the BS, guys. This is public health at work and it's data-driven. So but this is really, really great. The team also, what I love is that they're training people as they're getting Narcan and Narcan boxes out. So you can check this. Dr. Ludi, questions?
Yes, thank you. While you're on this topic,
Yeah.
I do some outreach to the unhoused, and I've seen a couple of overdoses
Yeah, me too.
out and about. I
Yeah.
mean, we talk about opioids, but there's some people who are clearly doing some other stuff.
We know.
Sort of wound up and everything. I didn't know if there was any kind of city report that tracked stuff that is out
Yes.
in the streets.
I love when someone says something that I didn't anticipate, but I have a really good update because it makes the city look really good. I just want to shout out the mayor's office because it was them that noticed that there was an uptick in overdoses, like you said, but really different activity. And we became concerned that there's something more, like something that may be a different or spiked drug that's out there. So they put together a task force. We've been meeting for 3 weeks. It brings together public safety, behavioral health, the city, the mayor's office and the Office of Violence Prevention. We've met with emergency room providers and are talking about ways to collaborate more. We've put together a task force because we were seeing a lot of overdoses around our city buildings, and we have been responding in real time. I just really want to shout out again, my bureau is not even a year old, and they themselves have administered Narcan over 5 times in the last 3 months around city buildings. And because we've had boxes, other people have been empowered to do so. We work closely with the Department of Health and Human Services, who are also on this task force. They oversee the homeless. So we've been doing joint outreach, long-term, and engaging folks. So we've been really proactive about this very issue, Dr. Ludy, because we've seen the similar thing. When I meet with you, I think we could talk more about the work you've been doing, because you've been out there much longer than my new bureau has. And so I want to make sure we're covering everything. But shout out to Dr. Julie Gary, our bureau chief, and the team. This is an area where I think we caught it early, and the task force has been meeting for over 3 months now. So the next thing I did was met with a state entity, and we're working with the county on an MOU to be able to test drugs in real time. So what happens is when a batch of drugs is collected by the police, it's kept and it's like tested for very common things. So I asked them if they could test to make sure we caught a new substance and could identify that in real time faster. So we're working on an MOU for that because their capabilities, it just wasn't part of a process and protocol. So that's what we've been doing in this space, but happy to take any questions. Does that help? I'll add it to our agenda, but I'm glad you're talking about it. And I want people to be aware that a lot of overdoses are happening in real time. It can be very traumatic. Call our bureau, call 988, and people can come and assist right away. But this is a big area of concern. This really warmed my heart. We are such a good partner that we have people who are posting about the work that we do and how we support them. This is the CEO and president of Live Recovery, who just made a post on Facebook, and we decided to add the picture because we also provide kits around hygiene and just to support folks as well in the mental and behavioral health space. And we do this for free and send it out to our partners. And she just was really moved by how these hygiene kits support their work as well and the living spaces. So please read about that more and look at the numbers. We're reaching a lot of people. So this middle column can become something you're used to, but please just read the numbers and think about ways to give us feedback. HIV, STI, and surveillance. I've been doing a lot of outreach this month, a lot of great education, really pushing PrEP as always. Communicable disease numbers in our TB clinic, very active. We've been seeing an uptick in a lot of vector-borne infections. Like we've said, 200% increase, which is why we did that extra piece at the beginning of the report. And of course, we're going to talk to you about COVID, but things like Salmonella, Giardia, and Campylobacter are out and about. If you're paying attention globally, the WHO have really sounded the alarm on Mpox as a public health emergency in Africa. We always know that it's a matter of time before it's here. So we have always stayed active in the Mpox space, but this is just to say infectious diseases are infectious diseasing at a high level globally right now. So the communicable disease team are very, very busy. I'll be inviting the Bureau Chief for Family, Community, and School Health to come and speak soon around a pilot program we're doing using ARPA dollars for doulas and CHWs. Really excited about, but other than that, they continue to be very active in the foundational areas with immunizations before school-led remediation. So another thing I want to sound the alarm is that we are seeing an alarmingly low rate of children being vaccinated with just their regular vaccinations ahead of school. Some schools won't allow children into schools if they're not vaccinated. So this is a campaign that we are assisting the IHN and all the FQHCs to really increase awareness and immunization. I think this is a really terrible byproduct of the COVID-19 anti-vaccine sort of crowd, and it's now affecting children. And we know children are safer in school. We know that, you know, measles outbreak, whooping cough outbreaks, things that we had almost eliminated are back. And this is something that I really want to curb in the city and region. So I will stop there and allow you guys to follow up on everything else. As always, shout out an employee spotlight. Our epidemiologists are just the bomb. I just want to tell you that they are publishing. They are being invited to conferences. They are doing data briefs for our partners. So for those of you on the board, if you need data for them to pull, they do the most amazing reports. They just did one around pharmacy deserts that's resulted in a collaborative effort that will be publicizing later with Shantae. They have done the childhood immunization brief that helped us to work with FQHCs to increase childhood vaccinations. So Matt Holden is an amazing epidemiologist, so positive, always at work, even though he can work from home. And his reports have been some of the strongest that we have. So please read up about him, and we just continue to celebrate our amazing team. Other than that, you'll see more of our community outreach efforts and upcoming events, including on Monday, I will be at SSM because our Behavioral Health Bureau has partnered with the first of its kind behavioral health urgent care that SSM is opening. There will be a ribbon cutting. Please join us as Board of Health members. Remember, some of you are not used to it. You are now celebrities. You are a Board of Health member for the city of St. Louis. It is important for you to show up to events and wave and kiss babies and take selfies with me. So I expect to see at least one or two of you there on Monday, and we can send you details on the time. Please be telling people to log in on Tuesdays, every Tuesday at 9 a.m. Me and DJ Tab, Streets 105.1, telling the people what they need about health. Other than that, you can see some of the other events and join us or ask questions if you'd like to join. Lastly, even though it's not in this, we need people to apply for jobs as always. And so I will have Erin continue to include that with active RFPs and future updates, but please continue to share through the Department of Personnel's website. That's all I have. I will stop and happy to entertain any questions.
Wow, thank you. That's quite the update, as you and your team always have. I want to circle back to a couple of the earlier pages that you had flipped through.
Okay.
Regarding the vector-borne diseases, is the department talking about the impact of climate change on the kind of increased prevalence, it seems, of some of what we are experiencing when it comes to some of these vectors?
Come through accountability, not enough. And I feel like especially Embal is someone that I really look to, has championed this. If you don't follow Embal on LinkedIn, I really think it's important, the leadership role that she takes around, and I never say the term right, but say the it's
Geospatial.
geospatial leadership. And not just that, she's very committed to, I think, mentoring the next generation of leaders and does a lot of regional collaborative stuff. What I love about Embal is that she's national, she's big time, baby, but she's very loyal to the region and to the city. And I just see her through SSM, but also through other collaborations. So I just wanted to shout out a board member's expertise, because Embal's humility will be her unbecoming sometimes, but follow her on LinkedIn and just see some of the amazing work that they're doing at SSM under her leadership. But around specifically climate change, I don't think we do enough, quite frankly. I think we focus so much on the day-to-day environmental health activities, but I would like us to be a little bit more proactive. So I may take a meeting with Embal soon and just see how she can help nudge us in a better direction. I'll be honest that because environmental health was the COVID sort of, the COVID central, I've just kind of had them heal and try to get their bearings. Also, they lost a lot of people in emergency preparedness, but that's not an excuse. I think there's opportunities, especially since we now have vested health promotions educators in almost every bureau. And so we love to standardize and do collaborative education. So from an education standpoint and campaign, we could start that right away and do a better job. But around actual activities, I think the best place that we do this is around housing. I sit on a committee that was national around environmental health and housing and advocacy around that. So that's one of the most formative ways, but around classical climate change, I think we could do a better job. And I'm happy to open up conversation about that. So I really love that accountability.
I didn't know if anyone else had any comments. Yes.
Can I just say, Dr. Monty, that was overly generous. Thank you.
True though.
And I would also suggest that I don't know many health departments that are able to think about climate change in the context of the work that they have to do all the time.
Yeah.
And so I think the work that you're doing and identifying these are vectors that are happening now, it's
Yeah.
due to climate change. We're not set up to as a public health system anywhere in this country to like, how are we doing this better? And I think the work we're trying to do, particularly important, is to say, okay, hey, you should be testing for these vectors. I
Okay.
think that's the shift for heat, flood. I'm thinking about mosquitoes and ticks, particularly easy to think about, and important to say, okay, now we have to look for these kinds of the different bugs that my colleagues work with.
Even that feedback makes me feel better, and Ball. And I think one thing you do is you're very respectful about being like, I'm not going to impose my expertise on you and assume you guys don't know. But on this, sis, I do need it. So even that positive feedback to say, no, what you're doing is on brand, or even to help with language, or even little basal things, because thank you for being one of those people that always reaffirms. This is the other thing about Inbal. I always felt like in the beginning I was doing a bad job as a new health director, and she'd be like, you're fine. Like the bar was in hell. And so for this type of topic too, that feedback would be helpful, Inbal. And if you see opportunities where we can do very simple but strategic things that just highlight that this is related to climate change, I would always appreciate that feedback. And I'm sure Shantae is, and her team as well. But I wanted to say, this is not a space to be like, she's got it, let me not impose. No, she don't got it. Like when I am an expert, I'll tell you, listen, pipe down, I've got it. This is not an area that I think we have a lot of people that are as comfortable. Justin and his team are phenomenal. And at some point, if we just want to have even a basal discussion, knowing we're not configured to do too much, but still saying, what can we do from a simplistic standpoint to make people aware that when we talk about vector-borne illnesses, we're also talking about the impact of climate change. I think there's an opportunity to just make that connection, even at a foundational level for people. So I appreciate that feedback.
Yeah, that's great. I'll give you a good highlight, good news that you can put in your pocket is that we don't really have tick-borne illnesses because we don't have the ticks in the city yet.
Oh, okay. I figured that from my ID days. Like whenever I would get tested for it for boards or something, it was always like in the rural areas, and I never saw a lot in the city. But I'm like, people travel, people do the vacation thing, so I want to make people aware. But I think it's also good. It's simple, fun facts like that. I think there's a way to be like, fun fact, we talk about ticks a lot, but this is really where they are in the state and where
they are in the county, but
really,
yeah, you do need deer to carry those ticks. And
there we go. Fun facts.
You're welcome.
Love that.
Thanks.
I see things in the chat. So Colleen reaffirming the trauma of the political environment is so real, and I hate how it's impacting people's inability to maybe be honest about things as they happen. But that's why we, the Department of Health, and you, the Board of Health, need to be unapologetic about saying the things out loud as they're happening. Is Listeria in refrigerated plant-based milk on the rise? Kristen, with the very specific questions. Girl, I'm not even gonna lie to you that I know that answer, but I love that question. And I am committed to getting you a very specific answer because I don't want to say I know for sure, but I love that question. And you know what? Let's shout that out. I think there's such a big population of folks who are plant-based now and who may not feel like they get the same sort of education around their health or know if it's different from non-plant-based products. So just maybe a little, another note, Shantae, to see if we can do a, love for plant-based people. Just want you to know that when we talk about non-plant-based food, it's the same for y'all, or no, there are these differences, but I will circle back around. Oh yeah, the Listeria outbreak from Boar's Head products and some serious illnesses. So another fun fact is DHHS at the state entity is really good about telling us when they're recalling food or if there's a situation. So we immediately send that to our Environmental Health Bureau and our Children's Bureau. And Shantae makes decisions about when she sends out health alerts that you guys get, or if it makes it to socials. So we try to be pretty good about letting people know that. But yeah, that was like a real thing. So that's all I see in the chat. If there's any other questions or comments, otherwise I will turn it back to our board chair.
Thank you very, very much. I would love for us to get kind of focused time maybe in the future with Justin or folks on his team, because I think that one, I don't know enough about what that team does. And I think that it's worth getting some of the highlights directly from him or from staff. And I would say that about other bureaus too. So perhaps as part of the departmental update section in the future, if we could have someone when they can directly representing the bureau to give a highlight of some of the work that they are doing that
I love that. I think
ties,
you're right.
ties into the CHIP and maybe to
Yeah.
some of the action teams too.
No, I do. I love that. I think the orientation was strong, but orientations can be a lot. And then it's like a few weeks out, you just want to maybe do a deeper dive. Shantae's coming next month. So after that, I'll just have all the bureau chiefs do a round robin and we can order them around, specific topics that may be of interest at the time, but maybe that can be our approach, board chair. So
Sure.
I'm happy to tell them that the round robin of coming and including the CHIP. And then did you in announcements, were you going to talk about the email we sent about the site visit? Or do you want me to talk about that?
Yes. So
Okay,
that's what I was
I'll
going
leave
to
that to you.
next. Yes. So Kristen noted in the chat. As far as announcements go, I had sent an email to members of the board yesterday asking folks to please canvass their calendars to see if folks could come in person for the December 19th meeting to be followed by a tour. And I know that there's at least one person who cannot make it, but certainly if we can make quorum work for that meeting, then I think we should move forward and meet in person. We had talked about meeting in person and doing a tour several months ago. And so I just want to make sure that we can get it on the calendar with enough time for folks to plan, because I know it might shift some of our mornings if we have to leave the house earlier or get to a place by 8. So that's something that I'm still waiting for some of you to send me emails about. And if I don't hear from you in the next couple weeks, I will be following up. The other announcement is really a question for folks to see who might be available to attend a conference in Columbia in mid-September. I forget the dates. Is it September 18th and 19th or September 17th and 18th? I'm not sure. But as part of a state funding package for public health, it's called the LPHA incentive, Local Public Health Authority. There's a certain list of public health departmental tasks that the state issues extra grant funds for, and I believe it's part of the core grant funding. But if we meet kind of different levels of these tasks, then the department gets additional funds based on what we are doing. So a couple of those items were related to attendance at conferences and meetings. You saw in the update that several members of the staff went to the NACHO meeting in Michigan. The other item that can help get additional funds is for a member of the board to attend the Missouri Association of Local Public Health Authorities conference. Did I get that right? Which is in mid-September. I am not able to go, and I know that Kristen is also not able to go. So we wanted to bring that to the rest of this board. And I don't know if Victoria, if you have any other comments or kind of thoughts about what folks need to know about that meeting, and also what the incentive package really means to the funding of the team.
Yeah, so the conference is in Columbia on September 18th and 19th, with an optional day on the 17th, half day. And it's really an opportunity. So an example of the innovation that we've been able to do with the first round of incentive funding is last year, most of the incentive funding or incentive activities were related to accreditation. And so we were able to meet all of the accreditation incentive items and received almost $200,000 extra in money from the state. And we are now using that to create an incentive program for quality improvement for employees that will be kind of a point system for employees when they engage in quality improvement activities. So that's one example. And so we're trying to buy a software that does this and also implement other things related to the CHIP and the CHA. So that's the kind of innovation that these extra monies help us be able to do.
Thank you. Following this meeting, I will send or I guess basically forward the email that has all of the info about the conference so that folks who have an interest in going can look it over and think about signing up. But as you've just heard, this is something that is really important to help achieve the kind of highest level of funding possible. And we've all heard and certainly know that public health is underfunded. So we want to do our best to make sure that we do have a member of the board attending. I see Dr. Tepe, you have asked a question. Oh, you might be able to go and you'll have a health equity fellow with you. Could you both possibly attend? Well, let me turn this back over to your team, Victoria.
Yes, so we can use the funding that we got last year to help with any travel costs. So I would say yes. Dr. Madi, I mean, she's the ultimate decision maker, but
All right, well, keep me posted. Yes, I'll have a WashU med student who's doing a health equity fellowship at the IHN with me for a couple of weeks, and it's during that time, so she could possibly attend with me, which might be a wonderful activity for her as well.
Love that, Dr. Tepe.
And then the last thing that I was going to share with this group is that FAB, which is the Public Health Accreditation Board. Is that what that stands for? They are going to be holding a meeting at the end of the month with members of the board. I think mostly former or current chairs of the Board of Health as part of the accreditation process and really wanting to understand the function of the board and how it is supporting the work of the department. So I don't know that I'll be able to attend. I have a conflict at the moment. Kristen, I don't know if you'll be able to be there. Yes. And there are some other former board chairs, but I think having, engaged and active members of the board who could possibly be a part of that meeting would certainly send a statement to that group about the work that the board does and how strongly folks might feel about supporting public health. So Dr. Mati, can I send that out to the rest of the board, or would you like to send it?
Shantae or Anika will follow up. I want to make sure that we're in compliance with FAB activities and I'm clear on the timings of things, but they'll send that out. But I do appreciate it. As April stated, we definitely have to have representation from leadership, and we've invited past leadership as well. This is the single most important part of this now. They come, we're going to get grilled, we're in prep mode, we're interviewing and memorizing and putting together binders. So send thoughts and prayers, but a good showing for the board is absolutely necessary because we otherwise won't look like we have our collective, together, and are supported adequately. And again, it's part of the requirements. So I just wanted to thank April and Kristen as always. Unfortunately, we got the notification about dates and requirements late. They kind of spring it on you. So we are requiring some level of flexibility with folks trying to be there. So I appreciate both April and Kristen, and I'll Shantae can connect with you after this about any follow-up questions and getting things out.
Thank you. Yeah, I've been through accreditations in multiple spaces, and so you can only prep and then hope that you've done everything that needs to happen, right? So I'm sure you have the most perfectly organized binders available. But yeah, those are the announcements that that I have. Are there others? I will yield the floor to anyone else who wants to share news.
I don't really have an announcement, but just wanted to show gratitude to the entire DOH team and the board. Just really excited about the collaborations that's been happening and the movement. I know it's been difficult, but love to see the great things that's happening. So just congratulations.
Thank you for saying that. Folks definitely need to hear that you're all doing a really wonderful job. So thank you.
Thank
for
you.
your
We don't get a lot
service.
of feedback
Thank you for your
sometimes.
time. Thank you for the expertise that you bring. And I definitely look forward to staying in this work with you all. Well, hearing no further announcements, I'm going to go ahead and call this meeting to a close, and we are now adjourned. Have a wonderful day, and I look forward to chatting with you all soon.